Hi, my name is Lucas Muñoz. Then, mutations and paragangliomas in cyanotic congenital heart disease. English, tutor Mr. John Moscoso. Definition: pheochromocytomas and paragangliomas are catecholamine secreting tumors of chromaffin cells with frequent germline, somatic, or post-zygote mutations in genes that are involved in hypoxia-related pathways. These mutations result in aberrant and constitutive activation of hypoxia-inducible factors.
So here's a question. Which of the following is a cyanotic congenital heart disease? The problem for me regarding this question is that remembering all 5 of the congenital cyanotic heart diseases is a pain in the ass. Luckily, there is a mnemonic to remember all 5. The first thing to remember about cyanotic congenital heart diseases is that they all begin with the letter D. The next thing to remember is that there are only 5 of these cyanotic congenital heart diseases, and the mnemonic follows the numbers 1, 2, 3, 4, and 5. Number 1 represents the great vessels joining to make one outflow tract in truncus arteriosus. Number 2 represents the major vessels being switched in transposition of the great vessels. Number 3 stands for tricuspid atresia. And number 4 stands for 4 defects in tetralogy of Fallot. Lastly, 5 stands for 5 letters for the acronym PAPVR, standing for Total Anomalous Pulmonary Vascular Return.
Applications in nursing. These mutations confer a new function to the mutation, and this discovery could indicate that they are involved in the development of paragangliomas in patients with this disease, says Villalona, 2017 in Ecuador. Pros and cons. These observations, along with the existence of a clear link between pheochromocytomes and paragangliomas with mutations that lead to the activation of HIF and cellular pseudohypoxia, suggest an exquisite sensitivity of chromaffin cells to HIF, a second mediate growth. Issue applied in Ecuador. These mutations confer a new function to the mutation, and discovery could indicate that they are involved in the development of paragangliomas in patients with this disease, says Villalona, 2017 in Ecuador. Conclusion: although these tumors are generally benign in 15 to 20% of cases, they are malignant and led to a reduced overall survival of 16% after the initial diagnosis. Currently, there are no molecular biomarkers that allow us to differentiate between benign and malignant tumors, so that the final diagnosis of the disease is based on the manifestation of metastases in the lymph nodes, bones, liver, and lungs of